Hey guys, so today we're going to talk about mobilization called the Lewitt Technique. So we use this mobilization to correct the steep first rib angle, and the first rib angle is just the angle between the sternal notch, and then you have C7 and T1 along your spine. So everyone's position is a little different, but those are the landmarks that we take when we're assessing our clients. So if we have a steep first rib angle, it will look a little like this. All right, so normal will be about 25 degrees. Then we have people that have like a little higher angle here, and then you have the steep angles here. So this would be, we'll have 25 degrees. If we have excessive, 125 will come down like this. That's when we use that Lewitt technique, and I'll show you how to perform that. And if we have less than 25 degrees, we'll come up to here, more like a military posture. All right, so we'll talk about a couple things here. So if we have a steep first rib angle corrective, so remember normal is 25 degrees. We have sternal notch, landmark C7 T1. And then again, if you have a greater than 25 degree first rib angle, we're going to use the Lewitt technique to correct that. And if you have an angle less than 25 degrees, you want to look at a couple of things. One, you want to look for reduced cervical spine curvature and also thoracic spine curvature. So it could be one staying nice and tall like this, and it could be reduced curve back here. You see a flatter cervical spine, or it could be just a reduced thoracic spine. So just flatter, let's say a flatter middle back, and those are different correctives. If you have like a flatter middle back, you want to do some of the foam rolling correctives that we did before, where we did the T-spine mobilization with the elbows here, with the roller. Just check out other videos. Check out the YouTube channel. Check out other videos of the T-spine mobilization. That will help to give you some more mobility with that spine. All right, a little bit more movement because you'll be a little more rigid. And if it's a cervical spine curvature, then you just have to work on some more movements of the neck. And it's most likely a combination of the cervical spine and thoracic spine. No one's just gonna like develop this way. You're gonna bring everything up, and that just comes with how you're trying to stand on a daily basis. All right, so now we're gonna go into how to actually perform the Lewitt technique for clients that have a first rib ankle greater than 25 degrees. Hey guys, so now we're gonna go into the Lewitt technique. So first things first, I'm gonna make sure I set my posture. I want the feet straight. All right, nice and tall. I'm gonna bring the arms out. And let's go. I'm gonna have both palms facing down first. I'm gonna flip one palm facing up, and I'm gonna face towards the palm facing down. Now to start the movement, I'm gonna inhale, exhale, rotate. Alright, so that's the Lewitt technique. It's really important that when you're setting your client up, you want to have them in optimal posture, right? Because if you're doing this corrective exercise, right, it's for a reason. So they'll most likely have a steeper first rib angle here, right? So you want to keep them a little tall in this position. So just be careful, make sure they're not like this. Keep them tall, keep them corrected, and just make sure they focus on breathing. Stay nice and relaxed throughout the movement. You'll feel a bit of, a little shoulder tightness as you go, just because you're going to be doing for at least 10 reps each side. So about 10 to 15 reps each side, each day will help you to correct the posture over time. And it won't take too long as you're doing, the other correctives and the strengthening that you have to be doing in your corrective exercise program. All right. If you have any questions or comments, feel free to leave them in the comment section below. Also, check out the website, DekhanaWellness.com. Thanks.